So welcome to TGH's newest podcast titled TGH Talent Talks, and thank you for tuning in. So we're going to have a little bit of fun while we learn about our team members, TGH, and the unique career journeys that it takes to work in healthcare. When people hear about healthcare or that you work in a hospital, people think you work as a nurse or as a doctor, and they don't necessarily recognize the career paths that are available in healthcare. So we're here to talk about some of our favorite positions and how you can join the healthcare world in something outside of just the nursing or physician world. And my name is Chanel Ray, and I am the Director of People and Talent Strategy. And I'm joined today by one of my favorite people at Tampa General Hospital, Hannah Mistry. Hannah works with me on my team, and I'm excited to unpack her career, which is one of over 800 positions that we hold at Tampa General Hospital. And hopefully by the end of the episode, you'll walk away understanding that healthcare can be really whatever you'd like it to be. So Hannah, if you would introduce yourself to us and give us a little bit about who you are.
Sure. Thanks for having me. My name is Hannah Mistry. I am the People and Talent Workforce Specialist at Tampa General Hospital. Like Chanel said, I work on her team, People and Talent Strategy. I manage our scholarship programming, our grants and our funding that help support a lot of our workforce development initiatives. And I guess a little bit about me is I am from Central Florida. I grew up right outside of Orlando, lived in Seattle for a few years, and in 2021 moved back to the Tampa Bay area. I found this role at Tampa General Hospital about 10 months ago, and it has been an exciting ride ever since.
So you're flow grown.
I am, I guess you could say.
Well, that'll do it. So you said you grew up in Orlando. Mm-hmm. What was that like?
It was very Disney-centric, I guess. And so I grew up right outside of Orlando in a small town called Claremont. Not a lot of folks know where that is, so I always just say Orlando. A lot of orange groves, a lot of dirt roads, but very close to Orlando, which is a great city, a great hub. And I went to the University of Central Florida. And so I love Orlando. It's not my favorite city in Florida, but that's why I'm here in Tampa Bay now.
So you said you went to Seattle.
Yes.
And what drew you back to Tampa and not going home back to Orlando?
Yeah. So, I mean, we really loved living in Seattle. Seattle was such a wonderful place, but with the timing of the pandemic and all of my family being here in Tampa Bay in the Dunedin area, it was sort of a no-brainer for my husband and I to move back to Tampa. We knew that we wanted something a little bit different than the Orlando area since we both grew up right outside of there, had been so familiar with it through the college years. And so many of our friends from college, so many people our age were already moving to Tampa. So many opportunities and different industries are thriving here. And I was kind of looking for something a little bit different in my career as well. And I just love the water. I love the ocean. I love all the wonderful restaurants we have. It's just really a great place for a couple in their 30s with a doodle to have a good time. And it's a great place to live.
It's great for millennial dog parents.
It really is.
Which is us.
Exactly.
Which is great. So when you went to school or when you were deciding what you were going to be doing in school, what did that look like for you?
That's a funny story. So, I mean, I had been so certain my entire youth, childhood, all the way through high school that I was going to grow up and be a doctor. I wanted to be an OBGYN. I wanted to deliver babies. I really was so set. There was no doubt in my mind. So I set out as a biology major at the University of Central Florida. And then in my first semester, had to withdraw from biology because I'm not very good at it.
Well, that'll do it.
So, we learn our strengths at a young age. And I'm glad I learned at that point because I was able to make a pivot still with plenty of time to graduate within a reasonable amount of time. And so at that point, I just kind of pivoted to something that I felt was reliable, which was business and human resources management. And really not something I had ever intended to use directly. I was still very much figuring out what I wanted to do. And so I did get that degree, but while I was in college, I was able to find an internship working in the nonprofit space. And I felt like I was able to use that degree, but also use it to do something that made me feel really good every day, made me excited to get up, made me go to a place and work 40 hours a week for free. for an unpaid internship. And so it really just kind of clicked with me when I was about, I think, 22 years old, right before I graduated college, that, oh my gosh, I could make a living out of this. I could make this my career. I could center my life's path on this. And so I graduated with my bachelor's in 2016, knew that I still wanted to be in the nonprofit space, but was still wanting a little bit more personal, professional development in that area. So I decided to pursue my master's degree. So I got my master's in public administration at the University of North Carolina, Chapel Hill, through their online MPA program, and was able to work in the nonprofit world while still getting that degree. And I actually graduated with that, like peak pandemic time. So it was a little anticlimactic, but still, fulfilling and exciting nonetheless. And since then, I've been able to use that degree truly every day in what I do. And now even in this role, while it's a little bit outside of what most of my background in nonprofit work has been, it's been immensely valuable because it just gave me so much real world experience of what the public sector specifically is like and what administration on that side of the world looks like. So yeah, that's kind of my educational journey.
She's a graduate.
Yes.
Why did you pick doing an MPA over like an MBA or an MHA or anything like that?
Yeah, that's a great question. I really did a lot of research. That's kind of a little bit of the core of who I am. I love a good research. I need to really know the background before I get into anything. And so I looked at MBA. I really hadn't considered an MHA because I wasn't sure that I still wanted to be in a healthcare space. But I was really focused on the MPA because at that point in time, I knew I loved the public sector. I knew I wanted to stay there regardless of what that looked like. And I also at that time was a little bit curious about the world of government work. And so that kind of gave me an opportunity to explore that world without committing part of my career to it. Turns out that I do not want to work in the government, which is fine. It's not quite for me.
Want to work for the government? Anyway.
And so it was really just a really great exploration of those spaces, nonprofit and government world. And I felt that at the core of what I wanted to do was make a difference and, support people who needed it, help vulnerable populations. And I felt like the best way to do that is through our government and through our nonprofits and those worlds working together. So even though I don't work in the government now, I think it's so valuable that I know how that world works because I'm working alongside government agencies all the time. So it's been very helpful.
That tuition is paying off, hopefully.
Well, we're
working on it. So you went to Seattle, moved back to Tampa. From everything that I know, that you loved your previous job and you loved working in nonprofits and you loved where you worked previously. Do you want to give us a little bit of a background of the last job you had before you joined us?
Yeah. So while I was working in Seattle, I had the really wonderful opportunity to work for an organization called Compass Housing Alliance. And they support the unhoused population there in Seattle, which is one of the top in our country. And so I got to really have a boots on the ground experience of what it's like to be unhoused, what sort of struggles those people go through, what sort of resources are helpful. And I loved that job so much and was very fortunate that when my husband and I decided to move back to Florida, because that was just the right thing for us to do, to be near our families, that when I put in my notice at that job, they were like, oh, actually, no, we think that we can make it work remote because what you do isn't necessarily, you don't have to be in person. I was working in a grant writing, fundraising sort of role. And so was very much able to do that remotely and had proven that during the pandemic. And so they were like, well, stay on, that way you don't have to rush to get a new job. And so was so grateful that they extended that opportunity for me because I was able to keep that job for an additional year and a half after we moved here. So I was working remotely and it felt like I had still one foot in Seattle and one foot here in Tampa. And I loved the people I worked with, a lot of social workers, a lot of people who just at the core of who they are, just cared about the people around them. And it was just a very, very good experience for me. And so after being in the Tampa area for about a year and a half, as much as I did love that role, I was starting to feel a little disconnected from this wonderful city that we lived in and trying to find a good place to plug in and a way to to really get to know our city better. And I was seeing a lot of, not the same, but similar kinds of issues that the work that I know how to do could help, solve some of those problems, things like that. And so had just kind of casually been looking for positions. I wasn't really super eager, but had just kind of kept my eye on the LinkedIn job boards and saw something come up for Tampa General. And it was a grant writer position. And so I was like, oh, well, that's exactly what I know how to do. And some of the focus of it was workforce development, which I'd had experience with in my previous organization. And then we had the interview, and you brought up a housing affordability and a lot of those areas that I have a lot of passion for. And so it kind of clicked, and the rest is history. I guess at that point, you offered me the job, and I took it. It was not an easy decision, I will say, but you made it easier by the nature of who you are and my experience in the interview, and just the excitement around working at a place like Tampa General that is so different from anywhere I'd ever worked. My previous organization was 145 people, supporting about 10,000 people a year. And now here I am at an organization of 14,000, supporting millions of folks every year. And so just looking for a new challenge and kind of found my way here.
So you pivoted to this job. You joined us. It's been about 10 months. Let's talk about your initial role when you joined TGH. What was the experience like from a team member experience when you were onboarding, and what the first 90 days at TGH really felt like for you?
Yeah. So I initially, as I mentioned, started as a grant writer. That's what I was hired to do. And at that point, it was very much in line with what the rest of my experience had been. And so I was, eager and ready to hit the ground running. But my first 90 days they were very, I would say, calm and kind of an experience I had not had the opportunity to have in the nonprofit space. I think, and a lot of organizations that aren't as well resourced as TGH, that you're often kind of thrust into your role, and you're kind of doing it as you're learning it, as you're still learning the organization. But with my onboarding at TGH, and I know that you set it up this way specifically as my leader, it was very much a slow rollout, and not necessarily in a bad sense, but more so I was given the time and the opportunity to really digest the information that was being given to me. I really had the chance to learn the inner workings of the hospital, to learn our service lines, to learn who the leaders are in the service lines, what we had been doing for grants previously. I got a lot of good opportunity to just meet a lot of the people that I was going to be working with to begin building those relationships. And I think that really it set me up so that on day 91, I was like, all right, let's go. Let's write some grants. Let's get moving. And since then, I've felt this just extra level of confidence because I had that runway at the beginning. And it's not something I've ever really had before. And so I think that was immensely valuable to my initial success in this role. And I think even more valuable in setting me up for this new role that I'm in now.
So let's talk through the transition from you started off as a grant writer, and when you introduced yourself as something different. So what was that transition period like? How did it happen? Yeah. And what do you do now?
Yeah. So like I said, I was a grant writer. I was writing grants. I want to say it was maybe month 5 or 6 where Chanel came to me and said, hey,
That's me for the Chanel. Listeners at home. Thank you.
She came to me and said, our team, the purpose of our team is growing, and the team itself is going to be growing, and we're taking on more initiatives. We need more capacity, more support. Let's kind of break down what that looks like, since we are the only 2 members of this team, and figure out, what kind of roles that would fit into. And if there's anything that interests you, then we can kind of work that into a new role. Because it was something that I had expressed wanting to grow and to try something new and to get into different spaces within our team. And so we went to WeWork for a morning. I think we were there maybe 3 or 4 hours. We got the notepads out. We had our little, write it all down and kind of break down the structure of what an ideal people and talent strategy team would be. And then you kind of showed me the board and said, is there something on here that appeals to you? Is there something on here that would make your role more fulfilling? Is there something here that you find you're drawn to or connected to that you would like to do? And education was one of those big pieces. And that's something that I've really never gotten to have a direct hand in, but I've always, it's been laterally related to a lot of the work that I've done. Education is so intertwined in a lot of the things that nonprofits do. And so was a space that I really wanted to get into. And so I said that, and you said, okay, like, let's figure out how to make that happen. How can we structure a new role for you that will work for you and still allow you to be a grant writer and keep that function? But how can we slightly expand that so that it works for you most importantly, but then also supports our team in the way that needs to be supported? So that's kind of how we evolved our role, or my role, into the people and talent the people and talent workforce specialist. And so, like I said at the beginning, right now, in addition to all of our grant funding for our workforce initiatives, I also manage our scholarship programs, which, entails everything from helping to guide the process for how are we determining which scholarships we're offering each year, what areas of our hospital need people to be pipelined through education to be able to fill some of those roles. What are the hospital needs? What are our team members interested in? What have team members reached out and asked for scholarships for, things like that? And what are some of the barriers that are keeping a lot of our team members from being able to achieve that next step in their career, move that next step up the ladder? And so was able to kind of step into this role, again, a new role within the system, and build it out in a way that works for me, that works for the team.
You do all the things.
Yeah, everything scholarship. I am the girl, and I also helped design the process through which our applicants will go through. So everything from what does the application look like? How are we releasing the application? How are people filling it out? Why are we asking for information? We want to be thoughtful about the time that it takes somebody to fill an application out, because a lot of these folks are nurses, are patient care techs, are people who are very actively on the ground supporting our patients in real time, and don't necessarily have the luxury of sitting down at a computer and taking all the extra time to fill something, a large application out. And so we wanted to make sure to be thoughtful about our team member experience, and also thoughtful about the way that we are selecting and moving through that process to make it as equitable as possible. And again, just focusing on what those barriers are and how can we best remove those for our team members.
Mm-hmm. I think one of the interesting things about your job, which I'm jealous about, but I think one of the things about your job that I think you have was a natural byproduct, I think, of what we were doing, but not something we planned for or expected, was the intense desire that people have to succeed, and that we recognize that there's a privilege that comes with having access to education and to development that isn't always available in places. When people, they don't get a choice in where they're born, or there are things that we have no control over, and sometimes our status is one of those items. But I think what I would be interested to hear from you about is, in your role specifically, what, in terms of the culture at Tampa General Hospital, about the desire to help people get to where they want to go, what has that been like for you? Have you felt that the organization is ready for that kind of movement, that we're supportive of the nature of the work that we want to do? Or do you think that we have the opportunity to listen and develop more than what we're currently doing?
Yeah, that's a great question. So I will say that part of one of the things that drew me to Tampa General initially was that desire I felt from the people I spoke to about supporting other people around them and helping them get to roles where they want to be, or to get into a position that is fulfilling for them and is what they want to do. And I want to say that even in my first couple of weeks on your team, you said, if a year from now you decide that you don't want to work on my team, if you don't want to work in this division, that we can help figure out what that pathway looks like for you. And so from the get-go, I felt very supported in that way. And so I recognize that that's, I'm one person, and so maybe not everybody has that experience, but I do very much feel that there is a general culture at Tampa General of wanting to support one another to achieve the next thing in our lives, whatever that may be. I always think there's room for improvement. There's always room to listen more. And I think we are seeing that kind of in real time as we're getting to administer some of these scholarships and move through some of these cohorts, some of the feedback we've been receiving and the suggestions for other areas where we might not have a scholarship program that might make more sense. And so I certainly think, especially with an organization of our size, that there is always, always, always room to listen to people more and to get that feedback. And I don't ever think that will be done, developing and evolving this part of our culture. I think that's something that is always going to have to be changing and moving.
We know that when people leave jobs in general, like you talked about your previous job and about how much you loved working there, and it was a difficult decision for you to go, that when, you love a job, or when you commit to working somewhere, or when you leave, is you're not always leaving. People have a tendency to leave managers and not organizations. So when we talk about the people that you work with, and we are a small team, it is just you and me, the divas, but when you think about what you enjoy about working at Tampa General Hospital outside of your job, because, you get fulfillment out of your role, but that's only part of it. It's the day-to-day, the people you spend time with. What continues to motivate you to show up every day?
Yeah, I think just the nature of what I am privileged enough to get to do for my role has so much fulfillment built into it. In the last month even, have really just enjoyed getting to hear the stories or hear from our team members about why they want to get a certain, certification or a certain degree, what they see their own future being. That's something that has always been kind of the crux of my passion in the professional workforce. Is I love to help people facilitate what it is they want to do. I love to hear about what gets people excited, what motivates them. I think that everybody's so unique and so different. So I just really am intrigued by that whole thing in general. And so that, very much is a big motivator for me, just getting to do that type of thing. And awards, I don't necessarily get to award the scholarships, but be a part of a process that allows for people to be able to take that next step in their education and truly transform, where they are in their lives and what their futures may look like. So that's a huge, huge piece. And then on the other side of things, I love the people that I get to spend time with. Not to put you on the spot, mm-hmm. but I love getting to hang out with you. It doesn't always feel like work. I'm always, every time I go to the office, because my role is hybrid, so I don't go every day. But every time I go to the office, I always leave with my cup just feeling extra full, because talking to you, gabbing in the hallway with other people in talent folks, talking to people down the halls in the hospital, having lunch with someone from the foundation. It's just, there are so many types of people and so many, different personalities in our organization. And again, it's just so exciting for me to be able to meet those people and hear about what makes them excited to come to work every day too. Because I would say everyone around me also has that kind of same level of fulfillment. It's a little bit contagious, I think, especially in people in talent. Everyone, we all kind of love each other a lot. So it's just never a dull moment. Always a nice smile on my face when I leave the office.
So what I'm hearing is everyone should work for me.
Oh, well, don't say that.
I'm hiring if anyone's interested. So we talk about the type of work you get to do, and you said you get fulfillment out of hearing the stories and talking to the team members. Is there an interesting story that you have that you would be comfortable sharing with us about a fulfilling moment for you where kind of everything came together and you said, okay, this is the place for me to be, or this is why I do the work that I do?
Yeah, no, that's a really great question. I have so many examples of that. I think, again, this role, I'm very fortunate to have a lot of the warm, fuzzy moments in my day-to-day. So
are there any fulfilling stories that you have? You talked about it in your role, about the warm fuzzies you get to feel. Do you have any fulfilling stories while working at Tampa General Hospital that you'd be comfortable sharing with us today?
Yeah, sure. So I mentioned that I do get to work on our scholarship programs, and that is in and of itself is such a joy, and getting to give people that opportunity to take that next step. And most recently, we ran our cohort for the surgical technologist scholarship. And I was very new in this role, and I still am, but even newer then. So I was a little bit trying to figure out the process as it was happening, and it kind of felt hectic leading up to it because I was still kind of getting my bearings and wanted to make it just a very successful and seamless process, particularly for our leaders and for our team members who go through it. And after all of our interviews and the decisions were made, getting to make those phone calls to our 2 scholarship recipients and to just hear, that weight lift off their shoulders of, this opportunity has been given to me and now it's going to transform my life. And now I can, put myself in a better place so that my wife and my kids will be better supported, or that, I've always wanted to be work in surgery, work in clinical, but I didn't have that pathway, naturally. And so was looking for a different way to do that. And so, just getting to make those phone calls. It was a Friday afternoon. I mean, I remember it very vividly. I think I was in Ohio, and I called remotely and said, "Hey, this is Hannah." And, no one ever wants to get a phone call from someone in people and talent.
Correct.
And so as soon as they realized what I was calling about, just that change in their voice and that excitement, and one of the calls, I could hear a family member in the background, cheering them on. And so just very real time getting to see that change. And now we get to celebrate those 2 recipients in an upcoming breakfast celebration, to really recognize this achievement and to send them off on a good note right before they start their program later this month. And I also just look forward to getting to, support them through that program as well, and check in with them and offer, any kind of support I can from the position that I have.
When your husband was really involved in the support model for you getting promoted while you were in your new role at TGH, what does your husband think you do for a job?
This is so funny. I think just working in the nonprofit world, especially with fundraising, people kind of like short circuit a little bit when I try to explain to them. He understands what I do now because I've explained it to him, but he's like, "Oh, so you just work in HR?" Like, I didn't think you wanted to work in HR. I know you have a degree in HR. And I'm like, well, no, I'm still doing a lot of the similar things that I've always done and the things that I love to do, just in a little bit of a different format. But I get a lot, especially as a grant writer, I get a lot of people who are like, "Oh, so you just fundraise for volunteer, like for fun. What do you do for a living?" Like my in-laws very much had a little bit of a learning curve there to understand that what I was doing was really my career and something that I was intentionally pursuing, and not just, a fun volunteer gig on the side.
What do you mean supporting people is a real job?
Yeah. Yeah. And now even I feel like when people ask me what I do, I say Tampa General, and then I immediately say HR. But then I feel like I immediately have to, give another disclaimer that I'm not a doctor. I'm not working in like payroll or team member relations. I'm doing this very niche, very specific, very necessary function that just happens to live in HR because that's where it makes sense, or people and talent in our instance.
Can you imagine us in employee relations or team member relations? We are the team member relations issues. Just kidding. So as a side, when we talk about your experience having a successful leadership, thank you, that's me. But you talk about you've been very lucky in your career to have leaders that you've liked, not as much as me, obviously. But
of course.
When we think about what makes a really good leader, what does that look like for you, besides me?
Well, yeah, I was going to say Chanel Ray.
Thank you.
I have been very fortunate in my professional career to have leaders, 2 in particular, you being one of them, who have really they've set the bar very high, I will say. It's a few things. I think a huge part of leadership and having a good relationship with a direct report is trust. And I think that taking the time to build that trust at the outset of any kind of managee relationship is huge, because that kind of cascades into all of the other areas. And our styles, I think, mesh very well. And I understand that, not every leadership style is for every person, and not every work style is for every leader. And so that's also a big piece of it, is just that personality match. But I would say about you in particular, I love that we have that trust, that you give me that independence and that autonomy to go out and, try things my way and do things in a way that works for me. And then if I need help, I can always come back to you and ask for it. I really appreciate an open communication style. I love somebody who is not afraid to tell me the truth and not afraid to be candid or frank and upfront about something. I always love to know a why and the context around things. And so that is something that I would say I very much get from you. It's just making sure that I understand why certain things are happening or why you're asking me to do something. And there's never really any surprises either. I think having that open communication is huge. You and I always talk about, like, in a performance review, there should never be a surprise. Nothing should ever be brought up that we haven't talked about previously. And so I very much feel like we have that relationship. I had that relationship with my last manager at Compass. And then I think the last piece is really just seeing the humanity of the people around you, right? Like, I think sometimes managers, there's a lot of pressure put on leaders to deliver certain things and do certain things, and they can often pass that down to their reports. And just taking the time to recognize that we are all still humans. We all have lives outside of these jobs. We, at least you and I know we don't live to work. We work to live. We do not dream of labor, but
absolutely not.
But if we have to work, then let's do it with people who care about us and with people who are going to recognize that things are going to come up, that everything I'm going to produce is not going to be perfect, but I will give my best effort. And just you knowing that and recognizing that and being there to support in those moments where I can't give that 100%, I think is a huge, huge piece of being a good leader.
And we're going to do it with a lunch and a Diet Coke.
Exactly. And a laugh. And yeah, I think humor is so, so important too. We have to be able to laugh at ourselves. We have to be able to laugh at each other. If I don't come to work and smile or laugh, then, like, what are we doing? What are we doing here?
Boring. So you like me is what I'm hearing. Thank you.
Gosh.
Oh my goodness. So we're going to play a little game. So we just talked about what a great leader is, but we're going to play a game, and it's a blind ranking game. Ooh. So it's a game where you rank an item without knowing what the next item is. Uh-oh. And the topic for today is bad managers. So we're going to talk about the traits of a bad manager, and you're going to rank them 1 through 5 to determine what you think is the worst, 1 being the worst, 5 being still absolutely terrible, but more tolerable than 1. So we're going to lead with bad communication.
Oh, you're getting me right out of the gate, because I did just say that was, like, one of the most important things.
It's a trick.
Okay, I'm going to say number 2. I don't want to hit anything on the 1 because I feel like you've got something in there for me.
A leader who takes credit for your work.
Oh, that's not cool. That's dirty.
That's hater behavior.
Yeah, we don't like haters here. I don't know. I think a 3, because I still think there might be something worse on that list.
A leader who doesn't believe in work lunches.
Oh.
A company paid work lunch. A leader who doesn't believe.
Immediately, no. That's a deal breaker, ladies. I'm going to put that as 4 because it feels petty to put that as
remember
1.
You put that as 4 the next time there's no lunch. Just kidding. Unapproachable.
I think that's a 1. And I know that's like a little, I don't know. I think that's a 1 because I think so many of these other things are a product of being unapproachable. Like, your communication's not going to be good if I can't approach you to communicate with you. Mm-hmm. If I can approach you, I'm not going to ask you to go have lunch with me. So yeah, I think that's number 1 for me.
So that leaves us with management.
I guess that has to be 5, but that isn't.
That'll do it.
In my heart, that's probably number 2. Yeah, if I could re-rank.
You can't. That's not a part of the game. Thank you.
Okay.
Well, no takesies, backsies. It is what it is.
So sorry.
Well, again, none of those things are me.
Yes,
so you're
true.
welcome. But I think the purpose of doing this TGH Talent Talks as a whole, not just this, but every episode after this, is understanding the different types of roles that are available, and yours is a very interesting one. But it's also to attract people to the organization, because I think all of us started off in jobs. The job that I'm in now is not the one I started off in. The job that you're in now is not the one that you started off in here at TGH. So if you were to describe why someone should be interested in a career at Tampa General Hospital, what would be your sales pitch?
Yeah, I mean, I think first and foremost, there's something for everybody. There are so many different layers and roles and pieces of the puzzle that go into running a hospital, running a healthcare system, running Tampa General. There is truly so many things that you would not think of, like we've been saying, that are part of a hospital ecosystem. So I think first and foremost, no matter what you do, you can find something for you at Tampa General. I would also say that no matter what role you start in, there will be somebody around you who can help you get to that next place if that's somewhere that you want to go. And then I would say, finally, and I know I've only been here for a short time, but I feel like so many people around me have had, decades or years and years of experience at Tampa General and are still saying the same things. And I think that speaks volumes. That was a huge part of why I took this role and why I have stayed since, is because I can see what the future might look like for me. And that while I'm in this role now, and while I want to stay in this role now, if 5 years down the line, something changes or something else is made available, that I have that opportunity and I have that support, not only from you, but from all the other leaders around me.
Yeah, I would agree. And I would also add, I think it speaks to you and the work that you do, which is opportunity.
Yeah.
Yes, someone can help you get to where you want to go, but you can also help yourself.
Yeah.
That we have the resources and the people like you who create access to things that people historically have never had access to. That if you want to get a certificate in something, we have tuition, prepayment and reimbursement to help. If you want to go back to school, if you're interested in a career change, we have a wonderful talent acquisition team that allow us to explore those pathways, and the opportunities are there, I think, for the people who are looking for them.
Exactly.
And for the people who don't even know what they want to do with their lives, but they know they want to do something with meaning. And I think TGH creates that reality for people. And I think that speaks to exactly why your job exists. And jobs
100%.
like yours and like mine is to create that space for people. So besides working at Tampa General Hospital for me, because I'm great, I think for people like you who create the space for others to find opportunity.
Yeah, I mean, absolutely. And I'm, again, getting to see this very much in real time with our scholarship programs. It's sparking a flame in some people, where we announced our surgical technologist scholarship, and I had people reaching out, what is a surgical technologist? What kind of pathway could that lead me into? I'd never considered this. I work in environmental services, or I work in IT, but I've always wanted to get into the clinical space. And so, yeah, I think you're exactly right that we have those opportunities and those pathways, but then we also have such a culture around promoting that and encouraging and empowering our team members to take those leaps and to take those risks, because Tampa General will still be here to catch you.
Well, Hannah, this has been a wonderful learning experience. And I think people will be interested to know that a job like yours exists, and that a department like ours exists, and that People and Talent does more than functional HR. And I think that's the point of doing a podcast like this, is that people learn something new that they didn't learn before. Do you have any final words for us before we stop recording this podcast and finish our Diet Coke?
Well, I mean, I'm just very, very grateful to have been able to have this conversation. And I think the fact that we're doing a podcast like this in and of itself is another testament to the opportunities that are available here at TGH and all of the different ways that you can go, and that no matter which direction that is, that there's support from truly everyone around you to get there. And so just very grateful to be at TGH and to be in this role and to have you as a leader. So thank you.